Hi, I'm Colleen Hutchinson. I'm here with Stacy Brethauer at the Minimally Invasive Surgery Symposium at the Wynn Encore Las Vegas. Stacy, thanks for being with us today.
Oh, you're welcome.
I'd like to start first with if you can just give us a short overview of ERAS and minimally invasive surgery.
Sure. So enhanced recovery is a interdisciplinary approach to patient care that really focuses on a few things: trying to minimize the surgical stress, decreasing opioid use, which we all know is important, and it results in patients getting out of the hospital sooner, potentially better outcomes, and better patient satisfaction, hopefully. So we've taken this concept and we've implemented a pilot program called the Energy Project that's going to include about 39 centers across the country. We're going to run this protocol for about a year and see what it does to help move the needle in terms of length of stay, patient satisfaction, and outcomes.
Okay. What are the outcome studies telling us now?
Well, what most of the literature around enhanced recovery is in the colorectal literature and the orthopedic literature, and what it tells us is that by minimizing opioid use, you can actually get patients out of the hospital sooner because they have less nausea, less ileus, postoperative ileus, and better pain control with this multimodal pain strategy that we use.
Okay. What are some of the barriers to implementation and any solutions you see?
The biggest barrier is actually the fact that this is an interdisciplinary approach, so you have to get all the stakeholders on board, and that means your anesthesia team, your nurses, the surgeons, of course, are typically the champions for it. But there's a lot of stakeholders that are involved, and so to make it successful, you have to make sure everybody's tuned in and on board and implementing the pathway.
Okay. You mentioned the MBSA QIP Energy Protocol. Can you tell us a little bit more about that?
Yeah, so it's a protocol that's fairly prescriptive protocol that focuses on preoperative education for patients, preemptive analgesia, and post-op nausea and pain control that starts really when they show up to the hospital, and then follows them through that hospital period to try to minimize opioid use, increase ambulation, start oral intake early, all those enhanced recovery strategies. And then we're surveying patients along the way to make sure that we understand how it's affecting their overall experience. And so we'll have, like I said, around 40 centers participating in the study, and then we're in this run-up period right now, and then we'll start the project in July, and then we'll learn a lot, I think, about how to implement enhanced recovery in bariatric surgery.
And what would you say are the most important outcome measures?
Yeah, I think length of stay. So we've selected sites that had higher length of stay. So that was it's a very targeted quality improvement project, and we hope to, number one, move the needle on that and decrease the length of stay for those centers who are outliers. And then beyond that, we're measuring opioid use for every patient, and we want to see that we're having a dramatic reduction in opioid use, both because it prolongs hospitalization and nausea, but also because of the opioid epidemic. I think the fewer narcotics we give our patients, the less likely they'll be to have continue opioid use, and so that's a part of the strategy as well. And so those are kind of the two big outcomes.
Okay. So in addition to your academic surgeon day job, we know that you're serving as ASMBS President.
Right.
Is there anything you want to tell us about your year so far and what you're excited about working on?
Sure. So the Energy Project is a big part of that. So that's one of my big projects for the next year and a half is the Enhanced Recovery Project. Other things that we're working very actively on are engaging our state chapters to make sure that everybody's voice is heard in the society and that we address any concerns the members have. And we've got a structure now with most of the states being represented in the state chapter committee that we really have no reason not to hear everybody's voice when things come up. And then we have really put a focus on the private practice and community surgeons that are ASMBS members, and working with our chair of that committee, Rami Lutfi, we've got some initiatives started to help re-engage some of our private practice surgeons.
Sounds great. Well, thank you for making time to be with us today.
My pleasure. Thanks so much.